Hi everyone, I'm Priya Mistry, the TMJ doc. In today's video, I'm going to talk to you about nasal breathing versus mouth breathing. This is something that is often overlooked during physical examination for both children and adults. In my humble opinion, breathing, being essential to life, should be evaluated thoroughly and treated in a way that enhances optimal breathing function. So be sure to watch this video until the end to understand the differences between nasal breathing and mouth breathing and which one is most ideal. For those of you who don't know me, I'm a general dentist with a practice in beautiful Portland, Oregon, where I practice with my mentor, Dr. Arthur L. Parker. At our practice, we are limited and dedicated to taking care of patients with TMJ disorders. If you don't already, be sure to check out my Instagram. My Instagram handle is _TMJ_doc. Please also follow me on Twitter if you don't already. Tweet. And my handle there is @Priya, Priya TMJ. So on Instagram and Twitter, I post pretty frequently with tips, trivia, just general information about TMJ disorders. And so if you like to nerd out on this stuff like I do, be sure to check out my social media accounts. So let's get right into it. Which is preferred? Nasal breathing or mouth breathing? And the answer is exclusive nasal breathing day and night is far superior to mouth breathing. So why is nasal breathing so important anyway? Breathing through our noses and having our lips sealed is important because our noses have a special system that filters, humidifies, and heats or cools the air depending on the outside temperature before it's sent to the lungs. The lungs then receive this air and oxygen with the best efficiency once it's been filtered, humidified, and temperature regulated by the nose. After this, the lungs distribute this oxygen optimally throughout our bodies. Nasal breathing and sleeping with your lips sealed also help prevent nighttime coughing, dry mouth, bleeding gums, and cavities because the mouth and the airway do not get dried out as they do with mouth breathing. There are some people who literally cannot breathe through their noses because of a deviated septum, chronic allergies, or severe swelling that's causing obstruction of the nasal airways. So seeing an ENT, an ear, nose, and throat doctor to establish nasal patency, the ability to breathe through your nose, to make sure you have clear and open nasal passages is really important if you're unsure about whether you can breathe through your nose. If you're mouth breathing, all of the benefits of nasal breathing are bypassed. The air is not filtered, the air is not humidified, and the air is not temperature regulated. If the air is not filtered by the nose, then that means more foreign particles can enter the body. This can lead to more illnesses, which is definitely a concern with what's going on in the world today. If the air is not humidified, if the air is not temperature regulated, then the lungs don't receive it as efficiently as if the air was humidified, as if it was temperature regulated. So long story short, our bodies have to take big gulps of air and breathe really heavily through our mouths just to have the same oxygen saturation as we would if we were breathing through our noses. So think of watering a small plant. Now take a garden hose at full spray and try to just water that plant. It's kind of a big mess and the water goes everywhere. You need much more volume of that water to adequately water the small plant. That is mouth breathing. Now take that same garden hose and put a nozzle on it, and that water becomes streamlined, so you don't need as much water to adequately water that small plant. That is nasal breathing. So all that heavy breathing that mouth breathers have to do to keep up their oxygen saturation levels ends up stressing and fatiguing the body. And mouth breathers often end up feeling exhausted because their bodies have been working hard all night. Many people that have sleep disordered breathing, sleep apnea, and/or are mouth breathers have been diagnosed with fibromyalgia. They've been diagnosed with chronic fatigue syndrome. They've been diagnosed with depression. And oftentimes it's that their sleep and their breathing while they're sleeping has been overlooked. So by now, I think and hope that you understand the benefits of nasal breathing over mouth breathing. So if you are a mouth breather, once you've established that you can breathe through your nose, and this might require a trip to your local ENT that is airway friendly, then the next step is to see a myofunctional therapist, an MFT. So if you've been breathing through your mouth, then your tongue has literally been on the floor of your mouth your entire life. So imagine that. Try to breathe through your mouth with your tongue up against the roof of your mouth. You can't do it. So breathing through your mouth and low tongue posture, which is not ideal, go hand in hand with each other. So if you've been breathing through your mouth with the tongue on the floor of your mouth for a long time, then you're gonna need to do some work to retrain the muscles of the tongue, the face, and the neck to support nasal breathing and proper tongue posture. This work is called myofunctional therapy. It's a type of physical therapy that retrains these muscles to support proper tongue posture, nasal breathing, lip seal, and correct swallow function. So I explain more about myofunctional therapy in my video called What is Myofunctional Therapy? So be sure to check that out if you want more information on this amazing therapy that I've seen benefit so many people. The vast majority of my TMJ patients have low tongue posture and are mouth breathers. Many of them also have sleep apnea, upper airway resistance syndrome, some sort of sleep disordered breathing. These issues, the sleep disordered breathing, the mouth breathing, make the body work harder to keep up oxygen saturation levels. This hard work stresses and fatigues the body, and stress can induce us to then clench and grind our teeth. With clenching and grinding being 80 to 100 times more force than chewing, and sometimes more than that, this then exhausts the muscles of the head, neck, and jaw, as well as the temporomandibular joints, the TMJs. This then leads to TMJ disorders: clicking, popping, crackling noises in the jaw, episodes of the jaw actually locking or getting stuck, headaches, ear pain, jaw pain, neck pain, and more. The connection between mouth breathing, sleep apnea, and TMJ disorders is something that I see all the time here at my practice. And so when I see something repeatedly, it really inspires me and encourages me to make videos to get this information out there. If any of you have small children that are mouth breathers, that are grinding their teeth, it's worth getting their airway checked out by an airway-friendly pediatric ENT. These are problems that we can address in children, and they're easier to address in children than they are in adults. You may be able to save your children from a lifetime of TMJ disorders if you address it early enough and get them in with a myofunctional therapist. My daughter's 4.5. We got her adenoids out at 3, and that changed her sleeping and breathing overnight. So I've seen this firsthand with my own child. I've seen this with my patients time and again. So that's it, my friends. If you like what you heard, if you learned something new, click like below, subscribe to my channel, do all the things. As always, feel free to add some questions or comments in the comment box below. And remember, my friends, you can never have TMI about TMJ. Thank you.